Next modality, it's a repetitive stimulation. Repetitive stimulation mostly need to analyze neuromuscular synapses for different neuromuscular diseases. So we start monitoring and when we use linked parameters are already the same as previous. We use supramaximal stimulation for that point and ask to relax the patient, yes, and we start stimulation. Classically, we use high frequency 3 Hz stimulation. We start stimulation, and we will look at the 5 answers. Problem will be when the first answer we will repeat it several times and compare first and fifth answer. Now we don't see any decrement, it's okay. So we can see normal neuromuscular synapses work. So also you have used additional probe with exercise test. For example, if we have not very accurate data from Decrement-test, it's help us exercise test, and sometimes other techniques for totonization tests when, for example, we can't discuss with patients or children, for example. So it's good repetitive stimulation,